Bismillahirrahmanirrahim. I am Dr. Mohibullah Wazir, and the topic is the superficial peroneal nerve or superficial fibular nerve. Look, this is the common peroneal nerve, and it comes over here and lying lateral to the neck of the fibula and deep to the peroneus longus muscle divides into its two terminal branches, the deep peroneal nerve and the superficial peroneal nerve. So the superficial peroneal nerve, a branch of the common peroneal nerve, lateral to the neck of the fibula, deep to the superficial peroneus longus muscle. And look, it lies over here. You can see this is peroneus longus and peroneus brevis, that is the lateral compartment. It lies deep over here. This is the head of the fibula and lie lateral to the neck of the fibula. And this superficial peroneal nerve then descend downward, lying deep to the peroneus longus, and then lying between the peroneus longus and peroneus brevis, and then coming downward, it turns over here and now lies between the two peronei, this peroneus longus and brevis, and extensor digitorum, and comes out over here. And this you can see over here. Look, this is the common, and this is the superficial peroneal nerve or superficial fibular nerve. And it first lies deep to the peroneus longus, then it lies peroneus between the peroneus longus and peroneus brevis, and then it lies between the extensor digitorum lying medially and the two peronei, peroneus longus and brevis, lying laterally. It lies between the two. At somewhat 12 centimeter above the ankle joint, it pierces the deep fascia and now comes to lie between the skin and the deep fascia, that is in the superficial fascia, and divides into its two terminal branches, that is the medial dorsal cutaneous nerve and the intermediate dorsal cutaneous nerve, medial and intermediate dorsal cutaneous nerves. And it descends downward, and you can see it passes superficial to the inferior extensor retinaculum, while the deep peroneal nerve, it passes deep to the extensor retinaculum. And then it supplies the dorsum of the foot and the dorsum of the digits. Now, what are the branches of the superficial peroneal nerve? Note the point. The anterior compartment of the leg is supplied by the deep peroneal nerve. The lateral compartment, that is peroneus longus and peroneus brevis, or fibularis longus and fibularis brevis, it's supplied by this superficial peroneal nerve or superficial fibular nerve. You can see the branches given to the muscles. They are the branches given to the muscle by the superficial peroneal nerve. And then they're divided into two terminal branches which are cutaneous. One cutaneous branch is also being given over here that supplies anterior lateral part of the skin of the leg. Then the two terminal branches, that is the medial dorsal cutaneous and intermediate dorsal cutaneous, you follow, it supplies, look, the skin of the whole of the dorsum of the foot, and you can see the skin on the medial side of the big toe, and then the skin between the digits second and third and fourth and fifth. You can see the branches of this medial and intermediate dorsal cutaneous nerve, while the web space between the big toe and the second toe, it is being supplied, as you can see, by branch from the deep peroneal nerve. Otherwise, all the digits and the web spaces and the dorsum of the foot and the medial side of the big toe is being supplied by branches from the medial, dorsal and lateral dorsal cutaneous nerves. But note the point that the nail bed and the skin of the distal phalanx is being supplied by overlapping from the plantar surface of the foot by the medial and lateral plantar nerve. Like over here, in the same way in the foot, the medial plantar nerve 3.5 and the lateral plantar nerve 2.5 supplies the plantar surface as well as overlap to supply the nail bed and the skin of the distal phalanx, while the skin of the middle side of the foot, the middle border is supplied by saphenous nerve and lateral border is supplied by the sural cutaneous nerve. This is about the superficial peroneal nerve or superficial fibular nerve. Thank you very much.